Welcome back. In this video, I'll teach you how to read the ECG effectively. When you look at an ECG, you will see a grid, mostly reddish in color, and it extends horizontally. That's why we call it an ECG strip. You don't need to worry about the very small boxes, although for the sake of information, they make up about 0.04 seconds. The bigger ones are more important, and they make 0.2 seconds. So each 5 of these boxes makes up 1 second. And this is very important to know. The wave that we see in the ECG is marked by letters, and it follows the sequence of the alphabets. So we go for P, Q, R, S, T, U. And you need to know the meaning of these waves. To put it simply, in the heart we have two pairs of chambers, the atria and the ventricles. Whenever either the ventricles or the atria contract, we will see a wave, and whenever they relax, we will also see a wave. The contraction is known as depolarization, and the relaxation is known as repolarization. And of course, we know that the atria contract first, and then the ventricles. Then the atria relaxes, and then the ventricles relax. When the atria contracts, we see the P wave, and when the ventricles contract, we see the QRS wave. And during the QRS wave, the atria relaxes. So we should see a wave representing the atria relaxation. But this relaxation wave is covered by the large QRS. And then the ventricles relax and we see the T wave. Sometimes we see a U wave, but you don't need to worry about that. Now that we understand the basics, which are the P wave, the QRS complex, and the T wave, we can make comments on these waves, such as a peaked T wave, or an inverted T wave, or a wide QRS complex, or a very narrow QRS complex. We can also make comments about the duration in between these waves, and we call this duration intervals. The PR interval is very important. The QT interval is also very important. And these are the main basic blocks of the ECG. If you memorize and understand everything so far, you're already more than halfway through when it comes to understanding ECG. Now let's look at more advanced stuff. You can make a comment about the rhythm of the heart by observing the intervals between the R and the second R wave. So we basically look at the rhythm of the whole strip. We can also make a comment about the heart rate. The narrower the ECG, the higher the heart rate. The ST segment is absolutely essential. If it was either elevated or depressed, it can indicate a myocardial ischemia or myocardial infarction. In fact, we classify the cardiac infarction into STEMI and non-STEMI, which stands for ST elevation myocardial infarction and non-ST elevation myocardial infarction. So it is a very important interval. Anyway, so that's everything for the ECG and all the information that you need to know. There are some more detailed and highly advanced stuff that are out of the scope of this video, such as diagnosing cardiac medication toxicity and electrolyte disturbances. I'll probably make a video about these other subjects in a later time. Anyway, for the time being, thank you so much for watching, and hopefully this helped.